Hi everyone, happy to see you in the next video. So this is me, Jansi Mary, working as tutor at Tribhuvan College of Nursing. Today I have brought you the topic TPN. So what is TPN? It's nothing but total parenteral nutrition. So let's dive into the topic. Objectives. At the end of the lecture, the listener will be able to understand and explain the TPN, its components, and what is the procedure. Okay. So what is TPN? Total. Total means all of the calories or nutrient as a person requires it. Parenteral, par means beyond, enteral means gut or not involving the gut. Plus nutrition, what is nutrition then? It gives you energy. So required for growth and maintenance of the body. So TPN is nothing but a method of feeding that bypasses the GI tract and delivers calories via a vein. Okay. So keeping this in mind, let's go on to who needs TPN. Patients who can't eat, those who have severe malnutrition, those who have intestinal obstruction, those who have severe vomiting or diarrhea, and people after major surgery, after severe burns, and also cancer patients. So patients who don't have a functioning of GI tract or who have disorders as mentioned needs a complete bowel reset such as bowel obstruction, that is Crohn's disease, ulcerative colitis, that is severe diarrhea, and those who are unable to eat more than 7 days. Okay, so this baseline, with this baseline we'll see what it is. Components of TPN. So what is the components? The first facts are components are nothing but what? The carbohydrates. The contents are carbohydrates, protein, fat, electrolytes, minerals, vitamins, and trace elements, also water. So these are the major components of the total parenteral nutrition. So what is carbohydrate? TPN provides a complete balanced nutrition. It contains all the nutrients required by the body for developing, growth and repair, and also it gives you energy. So it gives given as a dextrose, main source of energy is the carbohydrate and also prevents the protein breakdown. What are proteins then? Proteins are nothing but it is given as an amino acid form, helps in tissue repair and also supports the immune system. So they are important for healing wounds and maintaining the body tissues. What are fats? Fats are given as lipid solutions or emulsions. So they provide concentrated energy and prevent deficiency of essential fatty acids. What are vitamins and minerals? Vitamin A, B, C, D, and K. Iron, zinc, magnesium. It supports the body functions. So vitamins and minerals are necessary for metabolism, immunity, and overall health. They are added in small amounts to it so that it gives proper complete nutrition. Moving on to electrolytes. As we had discussed in the earlier PPT, what is electrolytes? It is sodium, an atom of sodium, potassium, calcium, magnesium, phosphate, and chloride. So this electrolytes maintain fluid balance and also the heart function. So they are carefully calculated according to the patient's requirements. Okay. Moving on to the route of administration. So it is given through central line because it's highly concentrated. So usually via the subclavian or the jugular vein or the central venous catheter is inserted. Through that we give TPN. An infusion pump is also used to control the rate as well. Okay, the set rate will be already set. So moving on to the advantages. It provides complete nutrition. It prevents malnutrition. It helps in healing and it also acts as a life-saving in critical patients. So when life-saving, when the digestive system cannot function, it improves recovery and prevents the severe malnutrition. Okay, what are we supposed to do before the procedure? As nurses, what is important for us to do before the procedure, during and after the procedure? So before the procedure, identify or verify the doctor's order first. Identify the patient correctly. Explain the procedure to the patient. Check the TPN solution, whether the patient's name is correct, expiry date, and check for the clarity of the solution, and there must be no leakage in the pack. So perform hand hygiene, then check the vital signs, check the blood glucose level as well. During the procedure, what are we supposed to do? Maintain strict aseptic technique. Wear sterile gloves. Use dedicated central line for TPN. Attach IV tubing with filter. Prime the IV line. Remove the air bubbles. Connect tubing to the central venous catheter. Start infusion using infusion pump. Set correct prescribed rate. Label the date and time of infusion. Set correct prescribed date. Label the date and time of infusion. So maintain all this during the procedure. Okay. So note. Why note is given? Because never give TPN as IV bolus. Never stop TPN suddenly because it may cause hypoglycemia. That's why we check the sugar levels before we administer. So don't add medications to TPN unless it is prescribed by the physicians. Use infusion pump always to transfuse the injection. Nutrition. After procedure, what are we supposed to do? Monitor the vital signs. Monitor blood glucose level every 4 to 6 hours. Check the catheter site for redness, any swelling, any infection. Monitor intake and output chart. Monitor daily weight. Document the procedure. What are the complications then? Infections, fever and redness will be there. Hypoglycemia chances. Air embolism may happen and also fluid overload. Watch for these complications always when you're administering TPN. How do we document it? So documentation is a vital part where nurses document what they are doing. So when was it started? The time, type of solution you have given, how much is the rate of infusion, and also how the patient responded. You will mark all your vitals parameter and also the blood glucose readings in your documentation. To conclude, TPN is nothing but a nutrition given through the veins used when GI tract is not working. It contains carbohydrates, proteins, fats, minerals, and electrolytes as well. So it requires careful nurses monitoring or nursing monitoring. Hope you understood the topic. Thank you.